Welcome to Think Big with Dan and Qasim. Join hosts Dan Melnick and Qasim Masood as they explore big ideas, limitless possibilities, and engage with visionaries, entrepreneurs, and thought leaders who dare to dream big, get inspired, motivated, and find practical tips for personal growth. Think big, dream bigger, and ignite your potential.
All right, welcome to Think Big with Dan and Qasim, and our guest today is Sam. So, Sam, if you want to go ahead and introduce yourself, tell us where you live and what you do for a living.
Sam Yousif. I was owner, manager with a couple of individuals of a couple of healthcare practices, one in Oak Park, Illinois called B Health, and one in St. Louis called Boutique Physio, where I'm at right now.
Awesome. So, how did you get the idea to start this business?
Well, I was actually in the business. My brother and sister-in-law were in the physical therapy business. They had a few clinics starting in probably around 2010. I had joined them in 2015 as they were expanding, working primarily in the role of business development, helping them physically expand the practices themselves as they were building out new clinics. So my role was helping them build those clinics out from a project management standpoint, and then also help them develop the business itself in a sense of how to connect and network in the areas where they were opening up these clinics. The expansion continued, and I believe as we were discussed before, a lot of it really depends on the quality of the practitioners that you have. And as we had some exceptional practitioners with us, we did not necessarily want to lose them when life choices got in the way, so to speak, in the sense that they wanted to relocate. And so what we ended up doing is looking to partner and build clinics with them, depending on where they were going. So we had a group that was going out to San Diego, and we opened up a clinic out there, and we had another individual moving to St. Louis. And so we eventually ended up opening up a clinic here in St. Louis. And sometime in 2018, they decided they wanted to sell. And myself and a couple of the other individuals, really wanted to stay in the business and didn't want, sort of be done with it. And we decided to open up the practice in Oak Park and the one in St. Louis.
So, can you just, I just want to go backwards a little bit because you were talking about, you mentioned that your brother and your sister-in-law hired you to help lead their BD team. But what were you doing before? Like, what made it seem like this was, a good fit for you to join them and to help, head their BD?
Sure. So, as from a dual standpoint, my background from an education and work standpoint is in engineering. So predominantly most of my education, adult life was working as an engineer, which allowed me the role to get involved in a lot of physical developments, building structures, things of that nature, project management. The healthcare side of it really came along from the standpoint from a personal situation. My son was diagnosed with scoliosis in 2012, and that introduced me more in depth, from a healthcare perspective. A number of family individuals work in healthcare as doctors, dentists, et cetera. And so, I've always been fairly close to that aspect of it, but not necessarily from a personal standpoint, from the physical therapy side of things anyway. So my son being diagnosed with scoliosis, his mother and I were very much involved in trying to find alternative methods to help him through that process, get treatment. And we weren't very comfortable or happy with what was being offered at the time for adolescents who were diagnosed with scoliosis. Back then it was really fairly straightforward. You wait till the individual stops growing. If the curve is severe enough, you're having these 11, 12-year-old males and females put into very rigid braces that they have to wear, for 18 to 20 hours a day, wear them to bed, wear them to school. And that was, until they stop growing, and then they decide whether they have to have surgery or not. Other than that, the idea of a physical therapy intervention, even though it was out there in some areas, it wasn't out there in the Midwest. We came across a method called the Schroth method, which was born out of Germany, so the Schroth family, and it involves providing a very interactive approach to treating patients with scoliosis, whether they be adolescent or whether they be adult patients with scoliosis. And so that got me doing a lot of research. So my son's mother and I were very well involved in talking to a number of individuals who had that Schroth certification. And back then, it wasn't really physical therapists. There was only 2 that we could find within a couple of 100 miles of the Chicagoland area. There's a couple of chiropractors that one in particular that would actually visit the area. He was from New York and would come to the area and treat patients, basically once every 2 months. And so as we found these individuals, we contacted them, we met with them, and we started that path of having them work and treat my son. As I was going through that, my brother and sister-in-law were looking to expand, and basically got together with them as we were doing that, started to talk to them more and more about integrating the Schroth method and treating patients with scoliosis. And it's a fairly large investment to do that with a therapist, between the training, the clinical training, the schedule that you have to do. It's in the equipment that you need, things of that nature. So as we talked to them, the therapist who was in St. Louis, she had some experience in Schroth because originally she was from the East Coast, which it's much more predominant than it was here, finding Schroth therapists out there. And she's worked with some Schroth therapists. And so she, her and I started the program within the organization back then. I was able to get one of the therapists in our Chicagoland office to also get the training to be a Schroth therapist. I ended up having my son begin to see him at the time, and really developed it from there. From the standpoint is that's how I very much got more and more involved in the healthcare side of things. So, sort of getting touched by it through that from a personal standpoint in regards to my son, being able to do that research and finding that just that one area of practice was so important and so, needed, that got me into a couple of other areas as I look at relationships that I've had. So, my daughter had some women's health issues from an urgency issue. There was, my wife and her issues postpartum. So then we ended up, heavily getting involved in women's health therapy, because another area that's very undertreated. And it really became more of an educational standpoint. We invested in training a number of our female therapists to do pelvic floor and women's health. So as we got into those areas, especially being, currently, the next area that we are heavily involved in is vestibular. And so that really becomes addressing concussion issues, vestibular patients with migraines. And so, the reason I'm down here in St. Louis is we had brought on a vestibular specialist within the practice. And, so working with her, introducing her to some of our patients. And so identifying these areas that we see that there's a, sort of missing in from a therapy standpoint, and then investing in quality therapists and helping them help us develop that part of the business.
So I think that when it comes to lots of these things, to your point, it's a lot of people just don't know about it. There's just not enough information out there. And oftentimes, as you kind of alluded to earlier, until it sort of happens to you or somebody in your family, then like, oh, okay, now I need to go and do some more research. So really, how do you focus on giving people information? Because many people really just don't have the information to know, okay, this is a problem, this is how I can treat it in this most effective way that you're doing it. So what does that look like for you?
Well, I can tell you, I would say to myself, I do a very poor job of it. From the standpoint is I want to be able to do more, but we're hindered from the standpoint. Something I've learned on the business development side in trying to build the physical therapy practice is that you want to educate key individuals in certain areas. And I'll give you an example. We could use the scoliosis one as an example. As people are diagnosed with it, it's not the physical therapist that's doing the diagnosis. They see it as it's a spine structural issue. So it's either being noticed by their primary care physician if you're an adult, it's being noticed by the pediatric doctor if it's a adolescent, and then they're sending them to an orthopedic doctor. The key component, so that orthopedic doctor and or primary care physicians, they sort of become the gatekeepers. They are the ones who need to be educated and accept the fact that there is a physical therapy intervention, whether it be Schroth or some other, sort of intervention. We use Schroth because it is, currently the best known and so to be, very effective in treating patients with scoliosis. They're the ones who are passing along that information. That is the expert that is perceived in our society. So educating the individual doesn't necessarily, it's great that we can put out Facebook posts, Instagram, and things of that nature and try to educate the public, but they would see us, basically as you would any other person trying to push some sort of a medical intervention, because society has not put those same credentials, sort of and looks at physical therapists that way, even though they should. Physical therapists from a training perspective are really the ones who should be assessing and leading the charge in these areas of treating patients with orthopedic conditions, working in conjunction and coordination hand in hand with the orthopedic doctors. But that's not the way society has sort of branded them. That's not how we've been working. That's not how the system has been set up. So when you say, how would I promote it? It would be continuing doing what we're doing, is actually educating the primaries, pediatricians, and the orthopedic doctors that this is a method that should be introduced. And, I'll give you, when my son was in 2012, he was told we couldn't even get a prescription to do physical therapy, because back then, wasn't that long ago, the orthopedic doctors, and we're talking back then, it was Children's Hospital in Chicago, whether you went to Rush, there was no belief that physical therapy had any help or could do anything for patients with scoliosis. And they would basically just tell you, just wait till they stop growing, put them in the brace, and we'll see where things go from there. To where it is now, that there's a handful of doctors who are very aggressively pushing, hey, you know what? We've turned, we've changed our tune. We've come to understand what's going on, and they will refer patients to our practice for people with scoliosis. I can tell you now, we probably got a dozen males and females that are under the age of 14 with scoliosis. We have dozens of patients, adult patients with scoliosis, that we treat in our practice, to the point that every room, and I'll just like a quick picture in this room, every single room has these wall bars in them, and are equipped to treat patients, because it is one of the basic tools that we do utilize in there. So that's, from the standpoint of how development. Take it to women's health. Back then, you going to prenatal or postpartum women, talking to them about pelvic floor issues, you made very, very little inroads. One, it's not a topic that they necessarily want to talk about. It's not a topic that's necessarily shared openly. It's not a topic that people necessarily know that there are certain interventions. As you were having these discussions, you're finding out, women who had given birth dozens of years ago are still suffering very significant postpartum issues that never got addressed because they were unaware. The OBGYNs that they were seeing were unaware that pelvic floor specialists are out there, exist, and provide therapy. So along the same line, it's educating those gatekeepers, those professions that society has put in place to disseminate information, to be the experts. And so that's the system we collectively have to work at. And work, towards doing that. At the same time, we've been working diligently at elevating the position that our therapists take in healthcare, as being leaders, as being, helping coordinate the healthcare plan, et cetera. So I think, collectively, the combination of the two is really, it's a lot of work. I can tell you, it's a great deal of time investment, and it's, you end up hitting your head up against the wall, because I can't tell you the number of times is, even today, hey, I came in for a session and my back is still not feeling, any better. I'm going to go see my primary care physician. He wants me to come in. And inevitably you get a call. It's like, oh, they want to do an injection. It's like, you haven't actually done anything, and you're already to the point where someone wants to inject you with a steroid to help calm the area, and you physically, because they, their expectations like, well, I came to see your therapist and I'm not really feeling any better. Well, that's not what the plan of care is, and that's not how things actually physically work. So you'll go get an injection, you'll go through that process, and you'll feel good for a couple of weeks, and you'll be exactly right back to where you were, because you really haven't addressed the issue. You're only addressing the symptoms. And that's also what people have come to expect, right? It's like, you go to your doctor, they're going to give me a pill, they're going to give me a shot, they're going to give me something, and it's going to make everything better. It's not collectively the way things work. So that's part of it. People have to put work into getting better, and that's part of what we're trying to teach them as well too.
So as you say, that's your biggest challenge, is like education piece, like educating doctors, because it's like, to your point, right? I'm sure there's a lot of conflicts of interest, because you have the doctors have their clinic, you have your clinic, and ultimately the main goal in healthcare should be making sure the patient is healthy, right? So I think it's, I'm assuming it's probably a pretty big challenge. I'm not sure if it's your biggest challenge, but one of your biggest challenges is really educating these physicians and pediatricians about really what you believe and what you've seen based on years of doing this is the most effective method to treat these things.
Well, I agree, but the system is set up, and I'll give you a prime example. When the practice was sold, we ended up getting some significant insights in 2018, and so you have large hospital systems buying up, and we're talking about physical therapy practices, but this literally applies to a number of other types of therapies as well for individual practitioners, et cetera. So hospital systems buying up physical therapy practices, incorporating and putting them under their umbrella. The entire billing systems are set up so they're running through those hospital systems, which literally increases the rates or what's billed to insurances because they're reimbursing those systems at a much higher rate. As a private practice, we're limited. We have a ceiling as to what we can bill. Insurance companies adjust and they pay out a small portion. In a hospital system, those are significantly higher for the same or lesser services that we're providing. So they're physical therapists within those hospitals are getting reimbursed significantly more. So it becomes a profit center. So there's an incentive to make sure that all of that is kept under one umbrella. So it can be for any services. It doesn't necessarily have to be for physical therapy. That automatically sets up a system that's geared towards keeping everything in-house under one umbrella, billing as much as you can, and the incentive really becomes financial as opposed to what's best for the patient from a healthcare perspective. And in the long run, not even the long run, even in the short run, the most efficient way is to have the best people weighing in and treating patients for what's really is happening. Preventative, if we go back to Obamacare, the hundreds of millions of dollars that was invested in doing preventative care really ended up going nowhere. There was a whole system that was supposed to be set up that, hey, let's get into preventative care. Let's promote more healthier eating, more exercise, more screenings, things of that nature. Well, a lot of that didn't necessarily happen. We're sort of back to where we were, or probably in a worse situation now because the costs are so dramatically getting higher. And on the opposite end, you have insurance companies reducing the amount of reimbursements for care. And so you have less and less therapists accepting insurance or going out of network because they can't afford to treat patients for what insurance companies are willing to pay or what they believe is willing to pay. And the alternative is sessions are getting shorter and shorter. You go to your doctor, your specialist, you're seeing them for 10 minutes. You're seeing them for 15 minutes. You're seeing them for 5 minutes. You're seeing a PA because their system now has set up that they need to see as many people as possible in a short enough period of time.
Yeah, it's insane.
And you're waiting months if you think about some of the areas of specialty, your OBGYN, your gastroenterologists, any of the cancer specialists, et cetera, you're waiting months to
dermatologists.
Dermatologists. So, but you're thinking on certain healthcare issues, you can't afford to wait months to see those individuals.
Right.
Because if you believe you have a situation, months could mean life or death. They could mean, significant changes in your health. But
so in terms of like in this scenario, obviously, you mentioned that there are certain things that are obviously out of your control, right?
Yes.
Because ultimately, when you're going up against large hospitals that have a different interest and they want to keep things in house, that's always a challenge. But like really in terms of, I guess, solving this, like just from your clinic, I know like I guess like more like on a clinic focus level, like what does that like look like for you? I mean, is it really just the personal relationships with these doctors and explaining to them and really trying to push them to refer patients to you? I mean, how do you, I guess, overcome these hurdles? Because I'm sure, I mean, obviously these doctors that are prescribing or sending, patients your way probably are working at some of these hospitals. So like, how do you overcome these hurdles for your business?
Well, to us is staying consistent. So, we, in each of our practices, we have individual treatment rooms. We have, staff, or our therapists are paid what we believe they deserve to get paid. We're not negotiating. We're not, from the standpoint of, we're not asking them to see 60 patients a week. We're not asking them to treat patients for 15, 20 minutes for intervals. We've stayed consistent with that for the last decade, meaning, our sessions are in private rooms. We have very well-trained therapists. Their sessions are 45 minutes. We accept a certain number of insurances that we could afford to accept. And then the ones that we're out of network with, we have to offer a self-pay program. And we do payment plans. We have people who could afford our, from the standpoint of afford services. We're not asking them to pay up front. They pay as they go along. But what we see becomes important is that what we offer in the areas that we treat in are not necessarily offered with a lot of practices. When you think about women's health therapists, more specifically, there's a very few very well qualified women's health therapists to treat. And so yet there's, thousands, millions of women who need those services, men who need those services. Try to find a male pelvic floor specialist. It's rare, yet it's one of the areas that's significantly growing and has grown over the last several dozens of years. And you have people sort of going into that space, treating it with drugs, treating it with various interventions, where if you had qualified therapists in that area, it would make a significant difference. So collectively, the difference that I see is that we continue to invest in the quality of care that we provide, sharing that information with the primary care physicians and some of the other doctor groups. And then just, at the end of the day, it can't be about money. It's got to be a balance, because if it's about money, it would change your entire philosophy and approach. And that's, one of the reasons that you see a lot of the larger number of whether hospital systems or larger physical therapy practices that have, hundreds of clinics under one umbrella, that for them to make money, their therapists have to see significantly more patients, which means they're spending less time with their patients. And their incentives and their compensation to those therapists is based on the number of patients that you see. It's you can't, that model is not sustainable. If you're a therapist, your whole compensation is based on seeing more and more patients. It takes a physical toll on you. You can only get to a certain point because it has a ceiling there. And then you either end up moving, quitting, or changing, because you can't.
Well, I was just going to ask, do you, for example, run ads to, I guess obviously you have to inform doctors, but if you're trying to get potential patients who are even paying out of pocket, are you running ads to, if somebody's searching for something, they can find you on Google?
So we have not. And so really it's become, because we're fairly small, relatively speaking, like the practice in St. Louis is all self-pay. So all of the practitioners here are self-pay. It has been since the day we started. It's in a marketplace in which you have a very large number of medical specialists. WashU is down here, SLU is down here, very large medical facilities. BJC is here. So it's a very large medical community. So it draws a lot of experts in these university settings, in these research settings. So people from all over the country, even the world, come here for healthcare. Yet in the state of Missouri, you have a very low reimbursement insurance rate.
Right.
And so what we practice, because of the level and the quality that we practice at, people come to this practice with the expectations like, hey, you have elite therapists. And as you compare it to some of the other therapy places around, I have very complex issues. I have very significant issues, And so that combination attracts people to come to our practice because of what they know that they're going to get, but also knowing what's collectively out there in the marketplace.
So it's more so like a lot of word of mouth, basically.
Yeah. Yeah, and it's patient to patient. However, I can tell you it's taken a long time, but we literally have very much, a great relationship with a lot of the orthopedics that work in this area, that work in some of these facilities, the experts in those areas, because we've been able to share patients with them over the last few years. And so because, my partner and practitioner who is here, she's been practicing for 30 years, a very high level orthopedic experts. She has people coming from all over the country, or she gets sent videos, she gets sent details like, hey, help me diagnose what's going on, et cetera, et cetera. But that's allowed us to gain a significant amount of respect. The therapists that we bring in, we're building the same model. In the Chicagoland market, it's a bit different because you have a very large market, you have a significantly higher reimbursement rate. You have a number of very, very good therapists. The holdback in the Chicagoland market really becomes sort of from a historical perspective of the role that physical therapists have played and what their expectation and the role that they're expected to play. and it sort of minimizes the role that they should be playing. And to the extent, there's a number of physical therapists that are trying to break that mold, which is great. Us being one of them. There's, like I said, a number of exceptional therapists in the Chicagoland area, but the larger types of practices sort of stick to that same sort of model, of like, hey, seeing more patients, seeing them for a shorter period of time. We'll only do what we're told. We won't go outside the box. And so, you're treating the same way. It becomes very, very repetitive. It's effective only up to a certain point. It's effective to a certain segment of the population, a certain percentage of it, but it's typically, the therapists are not taking the role that they should be taken. They're not pushing themselves to play a larger role, to be the experts in that area of care that they should be. This is what they trained for. This is what they should be doing. This is the role that they should be playing. And I'm telling the things I tell you, it's like a number of them embrace it. This is what they want to do, but the system is not set up for them to actually do that.
That makes sense. So if somebody watching this wanted to reach out to you, do you mind sharing the best way to get in contact with you, maybe like your company website or social media handles?
Sure. I mean, the phone number, my email address is sam at the letter B healthcares with an S.com. And then, so that's it. Yeah, I was just saying that's in Oak Park in St. Louis. It's sam at boutiquephysio.net. And then the name of the two organizations are Boutique Physio in St. Louis and B Health in the Chicagoland area.
Awesome. Well, Sam, thank you so much for your time. We're rooting for you. Hopefully you're able to serve and help more patients. And yeah, thanks again.
No problem. I appreciate it. Thank you, Dan.
Thanks. All right.
Bye.
Bye.
Bye.